Create a new event. Yes. Oh, let's go back to that. Okay, currently selected video start at first timestamp. No. I don't know if I need to do that though. Let's see. Alright, so this will enable sync mode. Alright. So there's that. Okay. And then emit. Okay, show timestamp. Okay, here we go. This is, alright, so like when I do this, okay, so when I click on this here, so I'm gonna open this, okay? And so, where'd it go? Shoot. Okay. And then I can do this. Okay. And then I should be able to click when study session starts and I'll timestamp it for that. And then if they told me right. Because that's what I was told. Oh, sorry. Move this stuff.
All right. Good evening, everyone. My name is Dave Cronin, city engineer. And I'm here with city staff members Josephine Gonzalez and Jenny O'Brien and Dustin Smith tonight. And we will work alongside Pat Collette, the chair of the Multi-modal Transportation Commission, to facilitate tonight's meeting proceedings. This meeting is being recorded and broadcast live on the city's YouTube channel and public access cable channel 25. During the meeting, when you are not participating, please mute yourself by clicking on the microphone icon found on the lower left-hand side of the Zoom menu next to the video icon. When you are muted, a red line will appear over the icon. Muting your microphone during the meeting will make it easier for everyone to hear. You'll just have to remember to unmute if and when you want to speak. In some cases, we may mute or unmute people as needed to minimize distractions during the meeting. Please remember to state your name and title for the benefit of those listening remotely. You can turn your video on and off by clicking on the video icon on the menu. For the purposes of this public meeting, please keep your video on when you are participating in the meeting. When you are not participating, it's okay to turn your video off. Just remember to turn your video back on when you are participating. If you're participating by phone, you can click *6 to unmute your phone. For those using Zoom, somewhere on your screen you will see a choice to toggle between speaker and gallery view. Speaker view shows the active speaker. Gallery view tiles all the meeting participants. Individuals who registered in advance to provide public comments remotely will be called upon by name. When you are called on, please unmute your listening device and state your name before speaking. The chair will then call for in-person public comment for those who are physically present. Staff will direct them to the podium to speak while following social distancing and safety protocols. All motions will need to be stated clearly.
After a motion is made and seconded, staff will call on each member individually to provide
vote. Staff will then need to announce whether the motion carried and the count of the vote. And now I'll turn over the meeting to the MMTC chair, Pat Collette. Pat?
Thanks, David. Appreciate it. And this is Pat Collette, chair of MMTC. And tonight's meeting includes a study session on it's titled Community Health and Health Equity, and it comes out of our strategic or our retreat in which we developed a goal to develop measures for equity in the CIP and other projects reviewed by MMTC. And both Steve Evans and Gregory Critchlow worked with David to put together a panel for tonight's study session. And we were able to preview some of the materials last week and talk over the agenda. And I think it's going to be really valuable to us in terms of looking at those 6 objectives that we had developed and move us forward on the transportation equity front in terms of supporting decision making. So I'd like to turn it over to Steve. I don't think Gregory's on the call right now at any rate, and turn it over to Steve to go forward here. Before we do that, do we need a roll call for the study session, David?
Yeah, we'll go ahead and take roll call here to start off. If you can do that.
Okay.
Josephine Gonzalez, MMSO, sorry. Charlie Bryan.
Here.
Gregory Critchlow. Steve Evans.
Here.
Carol Bowen. Nick Kuzmiak.
Here.
Thomas Allen. Aaron Payton.
Here.
Patricia Collette.
Here.
Thank you.
Thank you. Now, Steve, I'll go ahead and turn it over to you.
Okay, thank you, Pat. As Pat noted, we spent a real nice hour and a half with a few folks last week or the week before, including Valerie, who's on the call tonight, and Jill, and gosh, I can't come up with all the folks from the Douglas County, but this issue, as long as I've been on this commission, we've been asking a lot of questions about how this should affect the decisions that we make and how we look at a lot of things, if not all of the things on our agendas. And I'll speak for myself a little bit. I've kind of struggled to find something other than a map to go to kind of figure out what does this mean to people that are in situations that we don't fully understand, and probably we could help more if we understood this whole thing better. I think what I'm looking for, what we shared with the group we met with was this is a complicated issue, but for this Multimodal Transportation Commission, we need to have what I'm going to call, and somebody correct me if you don't agree, a simple filter to look at equity, environmental justice through that lens and through that filter. And I'm going to say everything we do. I think at times struggled to like, okay, what does all this mean in terms of sidewalks would be, I think where it came up a lot was, okay, how are we moving around town with the priorities for sidewalks, and something doesn't seem right there. We listen to staff and see a very logical discussion about why the approach was taken, but we kind of scratch our heads a little bit with, why, and maybe we should look at this through a different lens in my mind. I'm going to ask, I think that's kind of my lead into this. I do think that I anticipated listening and asking questions. Valerie, I don't know if you're prepared to kind of run with this now, but I think from the group that we were with a week or two ago, I think you would be I think that's probably why you're here, is to do that. And also Jessica, I see Jessica's picture there. I think she's still with us, but there she is. After the time we spent, it really was like, golly, I learned so much in the last hour. And Pat, I think, Pat was on the call too. And we were like, gee, the people that Jessica put together for us was perfect. We've got a lot to learn. And I think we're on a learning curve here. And to understand the issue in its totality, but to figure out what we can do about it and what we're going to do about it. I'd even ask Jessica maybe next to talk about I just read your email again that you sent out after our meeting, Jessica, and we provided the group we met with 4 or 5 typical agenda items that, we wanted to say, okay, this is what we look at, and how can you help us kind of figure out what that toolkit might look like in looking at the typical agenda items that we have. I also, and this is something that we've talked about in every retreat I've attended, is, what is the expectation for this group? And I did point out also to the folks we met with that we're an advisory board, essentially. We are a commission. We meet once a month for 2 to 4 to 5 hours. And it's in a way a little bit of a limitation in terms of how we can touch big issues like this. So my request was to get help in providing us with a toolkit, a filter, a lens to evaluate the kinds of topics that we normally look at, and also to give staff the ability in preparing our agendas to point out resources, whatever would be helpful in our consideration in preparing for our meetings and making decisions and recommendations for what we do. So that's my long-winded tip-off here. And maybe, Jessica, I'd ask you to go next and maybe get Valerie to chime in after that. So if that works for you, Jessica, fire away.
Yeah, Jessica Morton, your Transportation Planning Manager. Steve, I'm actually going to yield the floor to Valerie because I think she's got a presentation to share some data and information with you all that you can kind of all then have a conversation and respond and react to. And so then if you have other specific questions, we can weigh in on. I'm happy to join that part of the conversation. But Valerie and Jill Jolliker, who should be joining us, have prepared something.
Okay, fantastic. Okay. It's all yours, Valerie.
And so can you hear me okay?
Yes.
All right, great. And I was thoughtful about your statement about a simple lens or filter because I'm not sure anything that I usually present on is ever simple. But I do have a presentation because that's where I feel most comfortable. It's something visual for you to look at and review. So I'm going to pop this up on the screen. I'm hoping that you can see it. And we can start from here. My name is Valerie Carson. I'm the Director of Policy and Planning for Lawrence Douglas County Public Health. I'm fairly new to this position. I've been here for 6 months now, but part of my responsibility is some of the work around the community health assessment and improvement plan. And so this really speaks to that. When I understood and was looking through kind of your bullet points about where you want to bring equity into transportation, what I was thoughtful about is how I see equity, but I think it will connect with your ideas around transportation. And just to be clear, if there are times within the presentation, because sometimes I start talking really fast, if someone would like to just insert a question, feel free to interrupt me. No problem. So equity itself, just by itself, is this quality of being fair and impartial. And in my work and that of Lawrence Douglas County Public Health, our focus is on health equity, which is attaining that highest level of health for all people in the community. And in order to be able to really achieve that, we need to have focused and ongoing efforts to address inequalities in the community, the historical and contemporary injustices, and eliminate health and healthcare disparities that are linked to social, economic, and environmental disadvantage. Let's see. So if the goal is for everyone to have a fair and just opportunity to be as healthy as possible, how does a strong multimodal transportation, how does that play a role in that? And so I wanted to spend my time talking and trying to connect some of those dots between first thinking about what the factors are that impact our health, those what we call social determinants of health, what health equities we experience here in Douglas County for some groups, what the local response is to address those inequities and promote health for all of our residents. And then specifically, how do transportation options and barriers impact that health equity? So this is one of the graphics. I think there are different graphics out there that are put out by different organizations, but it kind of gives us a feel to understand some of the different factors that contribute to our overall health. And I think there's a little bit of debate sometimes about the exact percentages for these chunks, as it were. But you see these consistently so that we know that healthcare, that access to healthcare and insurance status, that impacts our health. Our physical environment, very much so, the place of residence, exposure to toxic or environmental kind of substances, the built environment itself, and the buildings and transportation systems, et cetera. Social and economic factors, such as discrimination, income differentials, educational levels, et cetera, and health behaviors. All of these come together to contribute to our overall health. And the thing that is very interesting about, if you look at this proportionally, you start to realize that actually the majority of things that impact our health are actually things that are outside of necessarily the individual themselves, but speak to the broader community and the factors in the broader community and the historical issues that may impact that. So a person's health is primarily influenced by environmental conditions, social relationships, and the institutional structures that exist where they grow up, where they live, where they work, etc. And then those factors in turn have an impact on their individual behaviors and values, etc. One way to think about this is kind of what those impact and drivers of potentially inequities for different groups to experience. Given that different persons and populations are born and live in different contexts, it's not surprising that you start to see inequities around health that happens for different groups. I think this is a nice visual because when I often think about who a person is and their health, and you think about the health of a tree, there are things that are happening above ground to that tree that impact its health. And then there are things that are happening at the ground level in the soil and even in the groundwater that have an impact on that health. And I think this visual sometimes kind of points to when you look at health and you look at health of entire populations, you start to understand that there's much going on in the soil and the groundwater in issues around racism, poverty, environmental hazards and occupational hazards, unemployment levels, opportunity that have a huge impact on people's health that can then play out in different populations. So there's been a very purposeful shift from talking about the idea of equality versus equity. And so how does that differ? When we talk about equality, we're really talking about that all people are treated the same regardless of their needs and circumstances. But when we talk about equity, we're talking about that it recognizes that each person is unique and has a different set of circumstances. And in order to reach the same outcome, they may need different resources or opportunities in order to be able to get there. I think this is a great visual in the sense of if what you would like to do is promote more active transportation with, for example, bicycles, what you could do in an equal way is give everybody the same bicycle. But as you can see from the visual, that's not going to work for everybody to be able to be actively engaged with being able to travel with bicycles. And so you need to use different kinds of bicycles or different types of transportation in order to be able to meet everybody's needs. I often think another good example of trying to understand the difference between equality and equity when I get pushback about, well, I don't really understand why I need to give different things to different people, is I think about if you gave everybody the same set of glasses with the same prescription, why would you have the expectation that all of them would then be able to see the board well in order to be able to actively engage in maybe education or such? But we give them different prescriptions because different people have a different level of need. I don't know if you can see my cursor. Can you see my cursor? I'm not sure. Yes or no?
Yes.
If you look here to the right, these are kind of what traditionally public health has focused on. We look at those kind of what I would call downstream issues around risk behaviors, disease and injury, look at morbidity and mortality. But as we start to think, especially if we want to address health inequities, we really need to move upstream, further up here, where we're looking at those social inequities, those institutional inequities, and the living conditions that people experience in order to have a preventive approach to be able to assure that all, again, because if we're looking at for health equity, that everyone has a just and a full opportunity to be as healthy as possible, We need to be looking upstream, and that's really where we see in the emerging public health practice where the focus should be. It's not that we don't want to still think about risk behaviors, disease, and mortality, but we need to be thinking upstream in order to be more effective. And if you notice from the types of things that are described here, downstream is very much focused on often the individual. And upstream is very much focused on what are the broader systems, what are the organizations, what is the culture and the community and the way that it functions that may be impacting people's health. And that you can have a huge impact on a lot of people if you are focused upstream. So just to be clear, two of the greatest drivers of differential health outcomes are income levels and educational attainment. And this is some example of how you see income matters for what people's health is. And this is local data for Douglas County. So this is not national data, but this is local data for Douglas County that really shows the link between the increased likelihood of multiple negative outcomes to what the person's level of income is for the household that they live in. So as you can see here, for those whose income is less than $35,000 per year, they were more than 6 times as likely, more than 6 times more likely to be uninsured. They were 3 times more likely to have not accessed a doctor due to the cost. And they were 2 times more likely to report fair or poor health overall. And so another negative health outcome or similar link is between educational attainment and health outcomes. So here we see that if you have a high school degree or less, that you are more likely, that you're 3 times more likely to be uninsured than those who had more than a high school diploma. You are more than 2 times more likely to be a smoker and almost 2 times as likely to report fair or poor health. Finally, you also see a similar link between race and ethnicity and how it matters to your health outcomes. And one of these examples is your percent of births that are low birth weight by race and ethnicity. I think it's really, really important that even when socioeconomic status and educational attainment are actually controlled for, that these health inequities by race and ethnicity continue to persist. You also see this, and it goes beyond to, this also translates beyond just morbidity to mortality, where you see differences in life expectancy by race and ethnicity. Are there questions thus far? Okay, so we have this information. We can look at it. We can go, all right, we see there's a problem. So the question then becomes is, what is our community's response? What do we do about it? Because we know that this isn't fair and we know that this isn't just. And so our community's response to these health disparities, how do we intentionally take action to eliminate them so that everyone has that just and fair opportunity to be as healthy as possible, is we have what is called a community health assessment and an improvement plan that we engage in with partners across this community. So we are committed to, first, we need to assess what the current health status and needs and issues are in the community. And then we need to put together a health improvement plan that will focus on being able to address what are prioritized issues in this community and that address those health inequities so we can reach our goals. What you see here is what's called the 10 essential services for public health. And always throughout all of these types of activities, they are always centered around equity, with the recognition that everyone should have the opportunity to be as healthy as possible, and that our actions need to reflect that that's our value and that's what we prioritize. So that health assessment and planning, which interestingly enough, is we are starting another cycle of, because these are done every 5 or so years. And we reassess what we know about the community and its priorities, and we identify where we're going to focus moving forward. And so again, yes, this is about the every 5 years, and I'm sorry, I moved the slide. So if anyone would like here, I'm just going to tell you right now, wants to be part of this process and is thoughtful about it as we move forward, is we are starting this process again here in 2021 for the next 2023 to 2028 Community Health Improvement Plan. When we do this in this last 2018 to 2023, in this process, we completed a community health assessment back in 2017, and we identified several different factors that they thought were prioritized as important and were most contributing to health outcomes for communities here in Douglas County. We eventually focused on 4 different areas: that of behavioral health, healthy food and physical activity, housing, and poverty and jobs, which eventually became the anti-poverty. We also had one lens through which all of these were looked at, and which all actions and strategies were considered, and that was the lens of equity. So in the 2018 to 2023 Community Health Plan, we have 4 primary areas, and that's safe and affordable housing, which is convened by the Lawrence Douglas County Housing Authority; the anti-poverty focus area, which is United Way Douglas County and Human Services Coalition; behavioral health, which is convened by Douglas County; and access to healthy foods and healthy built environment, which is convened by Live Well Douglas County. We are also then working, as I said, woven throughout this is the issue of health equity and justice, and we are creating a new focus area called health equity and justice that at this point is being developed, and how it's going to be structured is still working. I want you to pay attention to 2 of these in particular, because we're going to go back to some of the objectives and their goals that are related specifically to transportation as we move forward. And that is the access to healthy foods and healthy built environment, and anti-poverty, which Joe will be speaking about. Finally, as we continue to work in the community across those conveners, and actually there's one thing I want to point out that I think is really important. If you look at this visual, you can see among those conveners that none of them are Lawrence Douglas County Public Health. In order to do the work of changing conditions in the community that are prioritized by the community, that work has to be done out in the community. It can't be done here at the health department. We act as support with our staff for these particular efforts and help them move that forward. But this really is something that needs to be leveraged by our partners out in the community that can influence and bring resources and build bridges to new partners to be able to do this work. And then there is always ongoing evaluation of what was achieved, because each of these put together their own action plans that had goals that they stated that were related to one of those areas, actions that they would take in order to accomplish those goals, and the types of objectives that they wanted to measure, whether they were achieving the goals that they had set. I think one of the things that's really important, and I just use this one as an example, is that's really important to understand in order to be able to accomplish any of these big, what I would call audacious goals, is that you need to have partners from all across the community that have different relationships in different areas of influence, but that would be engaged and committed to these particular goals. And so, for example, with the anti-poverty focus, you can see all kinds of different sectors being engaged in that work in order to be able to move it forward and for them to achieve their objectives. So I'm going to speak to one of the areas of focus just to give you kind of a feel for where transportation overlaps. With the food security and healthy built environment, what you can see here, which I think is important, is organizations that participated in creating that plan and implementing it. You've got a huge number of different organizations that are committed to that and that are bringing their ideas and what they can do and that follow through on those activities. And I just wanted to really emphasize the fact that for most of these areas of focus that you have a lot of different people at the table. I also want to bring that to your attention because all of these can use your assistance if you want to get engaged in them and you feel like that would be consistent with the work that you want to accomplish. For the food security and healthy built environment, they had two major overarching area goals, and both of those were really about healthy weights among county residents. And so one was by 2023 that you would increase the proportion of adults who are at a healthy weight from 41.1 to 43%. And by 2023, you would decrease the proportion of children and youth who are obese from 24% to 22.8%. These were going to be accomplished by focusing on two major areas, and that was increasing food security and access to healthy food, and by increasing opportunity for physical activity. So if we looked at the food insecurity and lack of access to healthy food, one of the things that they found when they were doing surveys and talking to people in the community is that low access to transportation, whether public transit, their own transportation, or to being able to basically access through walking or through bicycling, was identified as a major barrier to accessing healthy foods. And that the physical attributes of neighborhoods could influence levels of physical activity. For example, I think you made a comment earlier about, where do you put sidewalks? Where do you prioritize your sidewalks? Some of the goals that they identified was trying to reduce the households living with food insecurity in the county, which is actually, this was a goal that was achieved back in 2019. I'm going to say, unfortunately, with the pandemic, that there's a good chance that we may need to be still working in this area because I think a lot of people are now living with food insecurity that maybe had achieved that goal of not. Also looking at the percent of adults who are participating in recommended levels of physical activity. We're still working towards that also. Another area of focus was getting kids out and walking and biking to school and providing opportunities for that to happen. So looking at what percentage in the Lawrence USD 497 actually walked or biked to school. I know they're still working on this in Eudora and in Baldwin. Then the percentage of residents that live within 1/4 mile of a bikeway network. So you can start to see we're thinking about planning for transportation and spaces might be influencing whether or not people engage in physical activity, which would then influence whether people were able to maintain or gain a healthy weight. And the other physical and then the other health outcomes that would improve because of that. We also had with the food security and healthy built environment, the percentage of public streets with sidewalks on at least one side, trying to improve that. And I think about as you look at where health inequities are in the community, whether or not as you make those decisions about where to improve those sidewalks or increase them, are we doing that in spaces where people have poorer health outcomes? And the average number of non-motorized fatalities. it was really important that as we looked at this, that if we looked at and identifying what these objectives were and what they wanted to prioritize on, that those objectives were selected through a community input process. And that really requires not only that we go to our existing partners, but that we create spaces where people maybe who don't have transportation can still be able to participate, or for those that are in areas that maybe traditionally haven't engaged in public forums. Are there different ways to engage people? We had a survey, there were public forums, there were focus groups, etc. Trying to be very intentional and knowing that there were certain subgroups in the community that had poor health outcomes overall, and wanting to make sure that we were getting their information and their feedback to be able to incorporate into what these objectives were and what priorities were chosen. And we continue to do this work both in the anti-poverty focus, which I'll shift over to Jill if she's here, where they're talking about they have a transportation committees to move certain objectives forward. And then the healthy built environment and food security focus, Live Well Douglas County, both of those have worked groups that are leading efforts around that, and that community members and organizations volunteer to be part of those committees, and they are open and welcome to anyone who wants to work on those objectives. Is Jill joined us, Jessica?
Yeah, I'm here.
Okay.
Yeah, and I apologize. I'm in between meetings, and I'm sorry I was late to join. But thank you, Valerie, for laying a nice overlay of foundation for how we came about doing the work of the Anti-Poverty Plan. And thank you, Jessica and Dave, for inviting us to be able to share this with your group. After this presentation, and after you've all had a chance to think about this, we welcome any ideas and engagement that we can have at future conversations and where there's opportunities. But you see on the slide that Valerie's got for me here is the transportation focus objective within the Anti-Poverty Plan. And we had a developmental objective of by 2023 to develop strategies that impact safe, affordable, and accessible transportation opportunities and address barriers to driving poverty for low-income households. And I won't read through all the strategies here, but you can see that, some of the strategies that we look at here are related to, we mentioned the Human Services Coalition, and that's really related to conversations that have been happening for a good amount of time in the Human Services Coalition, which is a kind of organic group of human service agencies that started out just kind of getting together and talking about mutual issues where we could together have collective impact. The city and, the county and the United Way being some of the largest funders of human services in the community convened the agencies that we fund, and we quickly blossomed into a really large stakeholder group that meets on a quarterly basis and shares information, and again talks about collective impact opportunities. Transportation has consistently come up, and when we engaged in the work of developing the community health plan, transportation continued to come up, but clearly it truly is a cross-cutting strategy that impacts, as Valerie mentioned, the built environment. It also impacts other planks of the community health plan. It's influential into safe and affordable housing. It's influential into our behavioral health plan that the county's really been invested in, and that transportation is necessary to access behavioral health and other healthcare supports. But as it relates to the anti-poverty plan, we call for strategies that are multi-sector. So I kind of talked about that a minute ago, but also studies the local needs, barriers, and opportunities for our BIPOC community. One of the you'll see a slide here in a minute, but what our priority focus areas are for the anti-poverty plan, but we're very intentional in focusing on our BIPOC community and some other priority groups. And really just looking at, countywide transportation priorities, having those developed that are focused on the community health poverty reduction plan. And our focus of that plan is access to work, childcare, and access to criminal justice proceedings, and access to those basic needs that I talked about a minute ago. Next slide. So just a little background on how that how transportation focused objective was included. I mentioned some of that a little bit, but it was consistently listed as a barrier to accessing employment, childcare, healthcare opportunities, food, support services, and other resources by our Douglas County Human Services Coalition partners. And it was identified in the Healthy Communities Initiative Assessment grant, which you'll see those results here in just a second on a nice slide that is a part of that. But it continued to come up over and over again in some different human service, public health survey work and focus groups that had already occurred. But also it has been indicated as part of the county is, for the last 5 years, I think, been a part of the National Stepping Up Initiative, which is a collaborative effort between the National Council of State Governments and the National Association of Counties to work to prevent the incarceration of individuals with mental illness in local county jails. Part of that work identified some of the barriers that individuals face to being booked into our county jail in the first place, and a large rate of those folks that were surveyed and engaged with as part of the initial results of that project indicated that transportation was a barrier for these folks for a variety of reasons, whether it's resources for our homeless and indigent clients, community members, or because folks have lost their driver's license. One of the other work groups of the Anti-Poverty Plan is really digging into issues of the decriminalization of poverty and the impact of fines and fees. And what we know already is that there's a good number of Douglas County residents that have had their driver's licenses revoked because of excessive fines and fees. So we're engaging with the right stakeholders in our criminal justice system, but we also need to understand, as that we work through this plan, where can we have influence on a local level? Where is their discretion? Where can we make some enhancements? And again, the ideas that this group can help us imagine would really be tremendous. Next slide. This is just a screenshot of one of the some of the responses from that Healthy Communities Initiative assessment. And I specifically talks about barriers to employment. You see, folks wanted to hear a lot, understand in this group, how can we approach our work with an equity lens? You can see here that there's a lot of folks report that prejudice kind of sits at the top of that. So I think that's something to keep in top of mind. But then number 3 on that list with a good amount of respondents was lack of transportation. So there's a whole host of other issues there that I do think that our community health plan, the various plagues, are trying to address. And then what's our next slide? Do we have next slide? I forget.
I was just going to check that. Yes, we do. Did you want, or did we?
Oh yeah. So so just to give you a sense of what our priority, our goals, you see what our goal statement is, and it's and you see our overall objective. And I'll just real quickly call out, again, we are focused. You see our priority populations, and our Black and African American families sit at the top of that, along with our Indigenous, Latinx, Asian Pacific, Middle Eastern community members, but also looking at justice involved, formerly incarcerated residents with children under 18, single parents, female headed households, all working towards a goal, an overall objective that by 2023 that we create policy, systems, and environmental changes that result in an environment in which the percentage of BIPOC children living in poverty does not increase. That does not increase is really by design, and that it may not seem very aspirational, but it acknowledges the real impact that many of our families have had of COVID-19, economically, physically, mentally, spiritually, all the ways that our BIPOC community has been impacted by COVID-19. And if we can hold our numbers of children living in poverty steady, then we're doing pretty good. But that's going to be a tall order given the challenges that we already know our communities experiencing today as it relates to issues of housing and homelessness and employment. Next slide.
Mhm. And I think this one was replication, sorry.
Oh yeah, well, yes, and that's probably my fault. So I apologize. I think this might be the last one, but as we work through we operationalize the anti-poverty plan. It was only approved by the Human Services Coalition at the end of January, and there's a lot of pieces of this that we didn't want to reinvent the wheel or recreate groups. We knew there were groups that were already working on these issues, and we knew that there were processes that were already at play, and champions that cared about this work as well. And candidly, Jessica is one of those folks. So I want to make sure that I'm making sure that I recognize her and making sure that she's connecting dots, because she allowed me to have a series of meetings with her. She came to a series of our meetings, and now I really feel like she is equally invested in the work of our plan and trying to connect dots where she can connect them. So I look forward to any ideas that can come out of this group.
So Jessica, I think that was the extent of our part of the presentation. And so now we're open to questions.
Well, I would, Jessica, do you want to add anything? And if you do, fire away. If not, I'll make a few comments.
Sure. Jessica Morton, your Transportation Planning Manager. I have a few things I would just comment on before you start a discussion. So Jill is correct in saying that the MPO has began to engage in conversations about how we elevate equity. And we've heard some of your initiatives and your goals too from MMTC to want to broach this work. And my conversations have always been, let's bring the equity lens to all the work we're doing. And we will start that. We are already beginning some of that work on the back end, kind of not in a public process yet, but working with a community partner, Just Food, and mapping some client data and relating that back to transportation disadvantaged populations data, where we're starting to find that there's quite a lot of correlation between some of those groups where we're showing that census demographic data, and then where we're using a local organization's data to support what we think is the story about what's happening in our community. Our next broach, we're starting some conversations with Food Policy Council and community health planners about walk sheds and transportation access to bus stops and healthy food destinations, looking at where we have coverage and where we don't, looking at multimodal connections. So we're starting to do some of these processes to ask the questions and use the data and information that's available to us to help bring back things, I think, in planning and in processes like the ones you use, which I hope in the future will provide us an opportunity to update non-motorized prioritization policy, or possibly evolve the sidewalk, the pedestrian model. And so those are the types of things we are already working on. We also are underway on another initiative to procure, in a partnership with KDOT, a new mobility planner position that would be housed in our division that would be grant funded, which we believe can work with Human Services Coalition and the MPO's Regional Transit Advisory Committee, which convenes all of the paratransit and transit service providers in Douglas County to work together to address some of the needs that have been identified in the community, both through the Coordinated Public Transit Human Services Transportation Plan and in any of the community health planning around transportation needs. So we have some ongoing processes that I think you're going to hear more about. You won't hear about them specifically in terms of, we're not going to come back and report them, but as we go through the process, we are going to be working with the committees that are going to be established to do those processes like pedestrian plan to make sure that equity is evaluated and incorporated into the recommendations that we come back with.
All right. I want to give everybody else an opportunity. We're bumping into 6 o'clock here in about 10 minutes or so, but the two slides that Valerie showed that keep popping back in my mind were the bicycle slide with equity and equality, and that discussion. Really, I never thought about it in those terms. Maybe it's self-evident, but that could enter into a lot of things that we talk about. Just that aspect of, there's not, there's not one solution for everything. In other words, the other slide that I would like to spend a little more time with at a different time would be the upstream, downstream, and take a little closer look at the detail on that, because obviously you had to get through that slide pretty quickly, but those two slides, and I'm sure there's more, would be pretty valuable, I think, for us to look at it in a little more detail. And the last comment I'll make is there are a lot of identification of what the problem is. There's an enormous amount of information about people saying, well, transportation is an impediment to getting a job. And I think it's our job, one of our jobs is to figure out how to fix it. And it's not easy to identify a problem. It's really hard to figure out what you're going to do about it. When you make a broad statement about transportation challenge, well, what's the solution? Better buses, microtransit, bike paths, sidewalks, automobiles, shared automobiles. There's just so many different things, and what would be more appropriate or less appropriate for that population in a certain part of the community. So those are kind of my initial thoughts, and certainly Nick, Aaron, Charlie, and Pat, fire away.
Nick Kuzmiak, MMTC. I may as well get started. So thanks everybody for the excellent presentation, and also all the materials that were in the agenda. I did actually get a chance to read over all of them. So I'd seen a couple of those before, especially the community health plan, but I had not seen the plan to reduce poverty. Had a couple thoughts while I was going through, and if we have time, which we have a couple minutes, I was hoping to maybe touch on a couple of them. So I know that the affordable housing section doesn't necessarily pertain to MMTC. That's more of a Affordable Housing Advisory Board, Planning Commission, and then the actual governmental nonprofit organizations who deal with that. But a common misconception, I feel like, is that housing affordability is just related to the actual affordability of said house or the dwelling unit or the rent or whatever. But researchers over the past 5 to 10 years or so have come up with what they call the HNT index, or Housing and Transportation Index, which basically says that housing affordability is not just about what you live in and how you live in it, but where you live. So if you're really far away from everything that you need to access, it costs a lot of money to maintain a car and to drive it to places, or to spend a lot of time on the subway or the train or anything. And I think it would be good to maybe make that clear in the assessment of how or how not housing is affordable here. I think community discussion often centers on, well, we in, Brook Creek or North Lawrence, we always get all the affordable housing. You should put some in in far West Lawrence, or, like in the rural areas, which sounds great until you realize those aren't near any of the amenities most people need to access on a daily basis. So I think that's kind of important to keep in mind, not just in this group, but for a lot of people, that affordable housing is not just what you live in, but where it is. So just something I try to beat that drum about often. In the plan to reduce poverty, I had a couple of kind of more specific things. There was a slide or page in there about, how we can help improve transportation. Just that comes up again and again. Was there anything, I guess, specific that you're maybe hinting at with that, or implied, or, because I'm kind of seeing two ways about this. Do we just take what we currently have and make it better, have transit, but more buses, more frequent service, further reach, better stops? Or are we going to think about this in a totally new way? As I've been doing some sidebar conversations over the transfer center, the downtown bus transfer center and the Bob Billings Crestline one, we've come to the opinion that maybe fixed route transit with large city buses may not be all of the future. There may be room for things like micro transit, first mile, last mile micro mobility, subsidized ride hailing services. And I guess I don't know if that's the kind of thing that the authors had in mind, but that is something personally I'd like to look into either here or on Public Transit Advisory Committee. There was another thing about kind of childcare and just the initiative on childcare in general, and how do we get people access to, places to take care of their children while they're at work. And transportation disadvantaged population often isn't able to take advantage of these opportunities as much, just because it takes, a drive to get your kid to daycare for the most part. For example, is there any sort of idea floating around for a kids bus, a kind of subsidized bus service that can take kids from where they are in a safe manner with fully vetted drivers to the various daycares so that parents don't have to worry about driving? And finally, there was a cool section about decriminalization of poverty, especially around, revoked licenses and other various driving related things. Have we ever thought to put in speed or red light cameras? I know they get a bit of a knee-jerk reaction from a lot of folks, but the fact is, with the increased focus on interactions with police and BIPOC drivers, perhaps replacing those traffic stops with non-discriminatory automation could actually reduce in-person interactions, which could lead to significantly better health and stress outcomes, right? And then you could even tie ticketing and the rates that people pay for fines to any financial assistance that person is currently on, or even the cost of their vehicle for going in the other direction. So you could actually have kind of I don't know if this is the right term, but a progressive fine instead of a regressive one. Some countries are pretty good at doing that. I don't know if we're quite ready for it yet, but we do have the information. So just putting that one out there, and it's a subject I'd definitely like to get on in more detail and see why we don't do this really commonly used practice. So that's it from me.
Thanks, Nick. Other questions from commissioners or comments?
Charlie Bryan, MMTC Commissioner. I appreciate the presentations, and I think this topic is something that we need to spend more time on. But I would like to kind of just suggest a way that we can move forward that feels, at least incrementally, it's getting us closer to where we need to be. In the staff memos that are prepared for a lot of the decisions we have to make, or presentations that are made by staff, I think it would be really helpful to get from staff some written kind of description of the equity dimension to the decision that's being considered. And I think there's a lot of ways that could go, but I'd like to just kind of put it out there, like in the same way a few years ago, we kind of started asking for some expected elements in any of the memos around traffic safety. I think we could probably do the same with this. So it kind of leaves a lot of flexibility, like how does staff want to approach that? How do they want to systematically bring that into our consideration when we make decisions? I kind of think, Steve, when you made your introductory comments, that you were kind of looking for something like that, which sort of connects me back to your work that you did around the complete streets checklist, is there some similar documentation that could be used to at least help us start wrapping our heads around operationalizing how we address equity in our decision making. So I don't think there's a whole lot of time to probably get there today, obviously, but I think that might be a nice next step, just so we can see some progress this year. I think the background information is something we'll probably need to continue to invest ourselves in, like we did today, but I'd like to see something, even if it's just that staff commitment to addressing it. I think that would be real progress for our commission. Thank you.
Thanks, Charlie. I did want to mention that on our agenda, we have allowed till 6:30 for this discussion, up until that amount of time that if we need that. So just to give us a little bit more time, and to tag on to what you just said, Charlie, going into this, I was really looking back at what we wrote about what we wanted to accomplish as far as the objectives in this, and that had to do with developing equity impact statements for projects reviewed or decisions that are made by the commission. And and I know that at the time someone mentioned the equity impact statements, I think, that were coming out of the community health plan. I didn't see that terminology specifically in the community health plan when I looked through that, but and I looked through literature too there is some, but nothing very concise, and nothing like Steve you mentioned in terms of a easy to use toolkit that would really be able to help us develop that. But I do like that idea. If we can, I think staff needs. Well, I won't speak for staff, but I would think that in terms of what it is kind of specifically, or what lens we're actually talking about on different decisions, and really coordinating with the things that are the rest of the initiatives that are going on in the community, like the anti-poverty group and the Human Service Coalition and the kinds of things that they're working on. I was interested in terms of the strategies that were listed on that cross-cutting focus area on transportation coming out of the health plan to reduce poverty, about those strategies and how we can develop a dialogue between that group and kind of the things that we do. So I don't know if there are suggestions maybe from, I don't know if Jill's still on or Valerie, if as far as suggestions for how we can, the communication between that group and things that we're doing that would be helpful as far as helping to further what this group is, what the what the work group is doing, and our work, I guess, so that we're not duplicating. And that may be at the staff level in terms of, kind of keeping us alert to those kinds of things. But are there other mechanisms that you would recommend or that you would like to see?
But I don't know if Jill is still on. I'm thoughtful about assuring that the work, that all of our work is moving in the same direction, and that it supports and it even better complements one another, so it strengthens that work. I don't know whether that's an opportunity for us to have staff that might cross over. Okay, Jill had to leave. Thank you. And what those opportunities are, but I certainly think that it makes sense to be intentional about trying to connect those. It'd be terrible if we were at cross with each other, in the sense of the things that we were trying to move forward, you were trying to go in the other direction. That wouldn't make any sense at all. But I can't imagine exactly how that would work. But if we could be intentional about working together so that we are able to achieve both of our objectives, I think that would be great. I don't know what that looks like, but I'm glad to explore it, and I'm sure Joe would too.
Jessica Mortinger, Transportation Planning Manager. Maybe the first step is choosing someone who wants to attend their meeting and see how they work, and see what that looks like. Valerie, do you specifically have, I don't know what your steering committee or your structure is for working on development of that plan. You listed a lot of organizations in terms of their engagement. Maybe it's appropriate to have MMTC membership in that process. Like, let's start cross-pollinating in a way that we are making sure it's not just relying on staff, that these ideas in terms of your membership is also being tied back into conversations so you can alert each other to those things as they are occurring.
Well, I can certainly explore where, and that would be the most strategic. And we would welcome that. I'm not sure who determines the steering committee for the entire CHIP, but I do know that work around, for example, access to healthy food and healthy built environment, that those are very much open committees that would welcome anyone that would be wanting to come and work on that issue. I know it's the same thing for the anti-poverty work also, but I'm glad to provide connections there and find out a little bit more about how that might work and where the opportunities are. Glad to follow that up.
I want to jump in here. I think following up on what Charlie was, the comments that Charlie had, I think that starting to do something is important. I think that being part of a steering committee would be fantastic in getting to understand the bigger picture. I do think that the toolkit, and Charlie, that was a great analogy to the complete streets. And I think that this kind of toolkit would be something that we would use, whereas the complete streets list is more staff and consulting engineers going through a very exhaustive list. But I think one of our objectives should be to go back to our smaller committee, if that makes sense, or maybe add to that committee and take the same approach that we did for complete streets. And we met, I think over the period of 9 months on complete streets, a couple of times a month. And at the end of the day, Dave and Amanda brought it home, but we brought it pretty far to get it to the point where they could get the last mile done. But I think that it's great to repeat myself. It's great to kind of be part of a bigger discussion, but I think that I'm of the opinion that we need to start doing something and find a way to help staff help us understand kind of the nuts and bolts of these decisions that we're going to be making right away. So I'm with Charlie on that one. I think we need to get going.
Charlie Bryan, MMTC Commissioner. So I'm looking at today's agenda for our meeting that follows the study session. And each agenda item report, it looks like a boilerplate template here. Has an executive summary. Looks like there's a section called Alignment to Strategic Plan. There's a section called Fiscal Impact, a section called Action Requested. And I'd say, would it not be just a simple enough addition to add one section that says Equity Impact? And then it's just a sentence or two sentences. I mean, that feels like it starts us to acknowledge that we should be considering the equity impact when we make decisions. It's also starts to kind of represent to staff that this is an important element of our decision making, and gets them further motivated to further improve the operationalizing of that decision. Maybe it gets one day to a checklist of some sort. I'd love to see that. But as a starting point, I'd like to just even see a simple sentence that says equity impact. And then, if it says there is no equity impact, I mean, let's hear staff say that to us. Maybe it invites public reaction to staff's interpretation. Maybe it gets all of us to think harder about, is there in fact an equity impact? I think there is in nearly every decision. We just don't make it explicit. And I'm asking that we maybe just commit to at least asking for it to be explicit. And we'll likely get it wrong, but I'd rather get it started than be worried about getting it right. Because we'll get it right if we listen and learn from people and we try something. If we don't do anything, that's actually getting it wrong. Thank
But
you.
it does, this is Pat Collette, Chair of MMTC. It does provide a placeholder for that, to open that discussion and keep it in front of us. I'd like Dave maybe to weigh in on that in terms of what that would mean in terms of, looking at the agenda and being able to, put something in place like that for each of the items that are on the agenda.
Yes, Dave Cronin, city engineer. I think we can look to find a way to be intentional to
make sure that we describe how we've used equity in some of the recommendations and decision making. I know it's come up on a lot of different topics, from the sidewalk improvement program to school area crossing guards, and so I don't know exactly what format that needs to be in, but at least a start would be, to make sure that we are putting something in the memos to describe that work and thought that we've put into our recommendations. So I think we can have further discussions on maybe how that looks. Some of the memos they are kind of boilerplate memos that we use the same format as the city commission uses. And so I think one of the sections on there is it gives us an opportunity to include the outcome areas that the item aligns to in the strategic plan. And, as one of the commitments of the city is equity and inclusion. And so we're trying to measure those outcomes in the strategic plan with the commitments. And if we can, I think we've noted, I guess, with this discussion and previous discussions, that we need to keep continuing to think about equity in our decisions, and we'll continue to be cognizant on describing those in the memo somehow. And so whether it's a separate section or not, I don't know, but I think it's something that we can continue to make sure that we are being very transparent on with our decisions and recommendations.
Do you think that's something that we could start with the August agenda, is including that element in each of the agenda items?
Dave Cronin, city engineer. I think we can try to start doing that, yes.
One other comment I wanted to throw in, and this kind of came up at the end of our discussion the other day with Dr. Mohammed when we were talking about equity and equity impact. He brought up the issue of literacy, and particularly around the documents and the agendas and the supporting materials of the things that come out of the commission, and making it more accessible to to all levels in terms of literacy. I don't know exactly what that looks like, and I suspect that is perhaps a citywide initiative. As all of the commissions are working to in that area, with guidance from the, from his office and others to help us with developing that concept. Is there anything else, Steve, that you remember out of that discussion?
I'm glad you brought that one up. I don't recall anything else, but that was certainly a takeaway.
Other thoughts or comments or questions from commissioners?
Charlie Bryan, MMTC Commissioner. David, I just want to say thanks. I know it's not easy to get started in these things, but I appreciate your willingness to try to start something in August. And I kind of feel like we all just need to be, eager to see what you want to do and provide some, feedback to see how well it works. So I think getting started is probably the most important step, and I appreciate your willingness to do that. Thanks.
And I would definitely volunteer to keep our committee moving. And it's been, if there's anybody else that would like to join us, Pat's been present, I think, to most, if not all, of our committee meetings. And I think if there's someone that would like to commit to a little more consistent attendance at those, that would be a good thing too. So please let us know if you'd like to do that, Nick, Aaron, or Charlie.
Charlie Bryan, MMTC Commissioner. I'm sorry, Pat, go ahead.
No, go ahead, Charlie.
I was just going to suggest, I know you guys have been meeting, but would there be some benefit to just trying to think who else, it sounds like you've already been consulting with certain groups. Is there any benefit to trying to not institutionalize that, but at least make it more formal? Maybe helping with, as staff evolve, kind of how they want to present this to us. They might appreciate having some, sounding board before it gets to one of our meetings. So I don't know, just toss it out. I don't know if it has to be a whole bunch of us, but it probably is useful to have some sustained involvement by some folks that maybe you've already been engaging.
Well, really, it's just been myself, Gregory, and Jessica, Dave, and Pat for the most part. And we can certainly, continue along those lines. But Charlie, if you wouldn't mind, I think we're okay in terms of COMA. If you could attend our next meeting, and we won't be tying you down to a longer term commitment, but I think you would offer a lot in just getting this thing kicked off and kind of defining where we need to go and who we might engage with. If you could commit to that, I think that would be a great first step. And I don't think we're going to solve this in one meeting. I think this is going to be a while. And I think that's, that's a good thing.
This is
I'd be happy to, sorry.
Yeah.
I was just going to say, I'd be happy to help. I just, I think there's some people out there we need to also think about engaging.
Okay, well, let's talk about that. Dave, if you'd like to, Dave and Jessica, if you'd like to get that in our calendar before August, it would be good to report back in the August meeting.
Yeah, and if I can interrupt really quickly, Jessica Morton, your Transportation Planning Manager. I think Valerie is going to depart. Did anybody have any remaining questions for her this evening?
I think the main thing I was just going to say was kind of recapping our action plan. And the first was the addition to the agenda item. And the second was continuing the subcommittee. And then the third was circling back around to you, Valerie, as far as recommendations for if we're the best place to plug in terms of other activities in the community. I think those three action items out of this study session are a really good step forward.
Right, well then I will look forward to us continuing to work together for common goals.
Great. Thank you. Thanks for being here today.
Great job, Valerie. Thank you.
All right, any other last comments or questions here? Okay, I think we've completed the study session, so we'll adjourn for 10 minutes, reconvene at 6:30. Thank you, everybody. Okay. We can reconvene the regular meeting. Josephine, do you want to call roll for the beginning of this meeting?
Josephine Gonzalez, MSO. Charlie Bryan.
Here.
Steve Evans.
Here.
Carol Bowen.
Here.
Nick Kuzmiak.
Here.
Aaron Payton.
Here.
Patricia Collette.
Here. Thank you, Josephine. This is the July 7th meeting of the MMTC. We'll open it up with approving the minutes from the June 7th meeting. Has everyone had a chance to review those? Any questions or revisions? If not, I'd entertain a motion to approve.
Nick Kuzmiak, MMTC. I would motion that we approve the June 7th meeting minutes.
Okay, thank you. Second?
Steve Evans, second.
Thank you. All in favor? I guess we need to do, can we just do raise of hands?
We'll do the roll call for
Okay.
the approval.
Okay,
All right. Charlie Bryan
Aye.
and Carol Bowen.
I abstain. I wasn't at the meeting.
Okay. Aaron Payton,
Aye.
Patricia Collette.
aye.
Okay. 5-4, 1 abstain.
Thank you. All right, we'll move to public comment. Is there anyone who would like to make a comment to the commission? You're muted, Janet.
I have a couple of comments if you will entertain them now.
Certainly.
I had some concerns after listening to the staff report last month about the update on the sidewalk improvement plan. I've been very happy that the commission and the city decided to go with more frequently used sidewalks, but they could still do better by focusing on where people in the neighborhoods walk most. I walk a lot, and I can tell you in the East Lawrence and Old West Lawrence neighborhoods, 7th and 8th Street and in East Lawrence 9th Street get far more traffic than any of the North-South streets. So that's one general comment. While this is all on pause while they figure out what to do with the areas that they discovered are bad. And I can tell you that those sidewalks aren't nearly as bad as some other locations. The other concern, though, is if you go to 7th or 8th Street in these older neighborhoods, they have far more obstacles than other locations because they have alleys. And I have seen the city spend lots of time and money putting in ramps at street corners only to have drop-offs of 4 inches or more at the alleys. Hopefully there's a plan for those, but I have not seen or heard anybody mention anything about doing something at the alley intersections with the sidewalks. If you aren't sure what I'm talking about, I would greatly encourage you to take a walk from like 7th and New Jersey on the south side of 7th Street and go west to, if you go the way to Maine, it's a little less than a mile, you will see every imaginable obstacle for pedestrians. And my house faces 7th Street, and I see people walking a lot on 7th, and many people go by with strollers and so forth, and they frequently go into the street because of the alleys. We also have the bus stop, or the Greyhound and the Amtrak station off of 7th Street. I see people walking by pulling suitcases, and they wind up going into the street because of the alleys. So that's my main point. I've got lots I could say about sidewalks, but I hope you have a plan or will develop one on intersections of the sidewalks with the alleys. Thank you.
Thanks for your comments. We appreciate it. Any other public comment? Okay, I don't see any, so we'll move on to the next item in the regular agenda, and that is to recommend receiving the Naismith Mobility Enhancement Project field check plans and provide feedback. Is that Jake?
Yes, good evening, Chair and Commissioners. Jake Baldwin, Engineering Program Manager with MSO. And I'm here tonight to present our field check plans for the Naismith Mobility Enhancement Project. The last time we really spoke about this project was last year, and that discussion was centered on increasing funding to construct shared use path where possible, and that's the exhibit I'm sharing with everybody right now. And if you're part of that meeting, this will look familiar to you. This is also presented, or this may have been presented to the City Commission when they approved our 5-year plan. But the Multi-modal Commission did recommend increasing $50,000 to construct the shared use path where possible. So the exhibit was what was used to kind of show where we thought those areas were feasible. Blue meaning, hey, we have the right of way here, we can construct a shared use path. So just to refamiliarize you with the project before we get into the plan sheets, I wanted to touch on this exhibit one more time. So you've got 23rd Street here on the south. We're running along the east side of Naismith. If I jump to the next sheet, we'll see that it terminates at 19th Street on the north side. We do have a couple of orange sections in here where we said we think we can get a shared use path if we're able to acquire an easement. And this will kind of work its way out through our design with the consultant SBB Engineering. We do have a large section of shared use path in here as well. And then of course the magenta color is just going to be a regular sidewalk, 5 foot or 6 feet if it is adjacent to the back of curb. Other than that, before I jump into the plan sheets, I'm just going to touch on the project schedule. Again, these are field check plans, so we're between 30 and 50% complete. The tentative schedule we have now is to award this project, I believe, in January of next year and get it constructed by the end of spring. And that's largely going to be dependent upon easement acquisition. So if the necessary easements are acquired sooner, we might see this constructed sooner. Otherwise, I think that timeline is fairly accurate. Now we'll begin looking at the plan sheets. I think we've got 6 or 7 of them to look at. This is the first one. We've got 23rd Street here on the south. So as we look to the right, we're looking north. And again, we're on the east side here. So we kind of begin connecting to this existing sidewalk here. And it looks kind of goofy here right now because the consultant didn't tie into the existing sidewalk very well. So that's one of the changes that staff will be recommending. So we're not reconstructing something that's already adequate there. But we do begin with a sidewalk here, 5 foot sidewalk, 6 foot here on the back of curb as we get to West 22nd Street Terrace and move through. We do have a few, I would say, tight constraints with the right of way. As we approach West 22nd Street, you'll see that our right-of-way opens up as we get to the north. So this is where our shared use path will begin. And you'll notice that we do kind of have a shared use path with sidewalk ramp on the south side of the intersection, assuming that we'll be able to acquire any temporary easements that are necessary here, which should not be too much of a problem. Moving north again, we've got our 10-foot shared use path in this wide right-of-way corridor as we approach 21st Street. One change you'll see here is I think that the current transit stop is closer to the corner, and working with the property owner and transit, they're moving that just south of the intersection there. It's going to relieve a lot of congestion and concern with the property owner there, and I think gives us a better spot to construct the bus pad. And this is also a location where our shared use path will neck back down to sidewalk width. Again, we've got right-of-way constraints here and a very short driveway. Moving across the intersection to the north, again, we've got some right-of-way concerns here before we're able to jump back up to a full-size shared use path. But if I zoom in a little bit, you'll see we currently are showing an 8-foot shared use path here with a crossing. My computer, let me go to the next sheet. So we're continuing with our shared use path as we approach West 20th Street. This is a fairly wide open corridor. No real constraints with right-of-way or property trees or such in this area. And then moving north again. Here we start to get to the reverse curve area of Naismith. Again, looking somewhat to the north as we look to the right. We've got a lot of trees here and tough right-of-way constraints and steep driveways. So this is where we'll go back down to a sidewalk and try to minimize impacts to these property owners. We'll work with them on the trees as well as our forestry department to minimize impacts to them. We're also kind of being proactive with our water line. We've got some existing water line infrastructure in the ground here that isn't in terribly great condition. So we're working with internally with city staff to get those relocated prior to our project going in. That way we don't have to tear out a new sidewalk or shared use path. And again, moving to the north. Here we can see 19th Street show up as the end of the project on the right side of the sheet. In the exhibit, we did have this shown as shared use path where possible if we can get easement up here. I think there are some areas where we can construct easement if you can follow my cursor, really from this ramp to the north. If we adjust the alignment a little bit, we could probably get a shared use path in here and then maybe neck down to an 8-foot shared use path as we approach the corner, or potentially and hopefully a 10-foot wide shared use path with easement. I think just running through those plan sheets will give you a good idea of where the project's at, and hopefully if you've got any questions that piqued your interest, and you can feel free to ask those to me now. I'd be happy to take a look at those.
Charlie, did you have a question?
Yeah, this is Steve Evans. I have a few. I think we left this also that when Naismith is reconstructed, first question, when do we think that's going to be? And the second question is, the goal would be to make this a 10-foot wide shared use path in its entirety as part of the Naismith reconstruction. Jake, is that what we're thinking?
Jake Baldwin, engineering program manager. Yes, Steve, that is still the concept moving forward, that this project is going to construct a shared use path where possible, and that future project would fill in those gaps that we couldn't get with this project. I'll have the city engineer, Dave Cronin, maybe pipe in here. I believe the last time I saw that Naismith reconstruction in the CIP was in 23-24, but I have not had a chance to look at the newly proposed CIP.
Yeah, this is Dave Cronin, the engineer.
It's in the recommended 22 to 26 CIP for construction in 2024.
Great. Jake, are there many driveways that you would expect to have cars blocking the sidewalk or shared use path just because there's not enough room? And how likely is that to happen?
Sure. Jake Baldwin, Engineering Program Manager. The one I'm most concerned with is just south of 21st Street, where we relocated the bus stop. My computer's running somewhat slow right now, so I won't bring that up. I have spoken directly with that property owner, and they're happy with what we're proposing. They're actually thrilled about getting the sidewalk here, and I think they've constructed some additional parking kind of adjacent to their garage, and we'll be able to kind of widen their driveway to help them to that spot. So the impacted driveway is those folks are pretty pleased with the project so far. There will be a few others towards the north end of the project that will, there's an existing steep grade, and we're not going to be able to solve that with this project, but they're long enough that they'll have plenty of parking.
Yeah, that's all I have. This looks great. I'm glad we found a somewhat creative way to get to this this kind of hybrid shared use path along Naismith.
This is Pat Collette, Chair MMTC. Jay, could you talk a little bit about intersection treatments along this route? I'm thinking particularly of 21st Street and the Bike Boulevard, and what kinds of impacts that has on the intersection treatments, or is that addressed in this plan at all?
Jake Baldwin, Engineering Program Manager. No, there aren't any intersection treatments, just the sidewalk ramps that cross those crossing streets.
Hey, Kuzmiak, MMTC. Pat, since you asked about it, I want to kind of follow up on this. Since a lot of these paths that are crossing streets will essentially be SUPs, is there a plan for green pavement markings where the path crosses the street, or is that just not within the budget?
Jake Baldwin, Engineering Program Manager. I believe we're still working on the policy on where that green pavement's going to go, so I'm not sure how that would play into this project. But I would like to think that the budget could handle green pavement if it is in line with that policy.
Thanks.
And if it's not being constructed until January, is there likelihood that policy will be, can we expect that policy would be completed before that, so that it could be integrated into these intersections as far as the way this is done? Or
this is Dave Cronitz, the engineer. If there's a
policy in place, we could make the change to the plans to reflect that policy. So we've had some discussions on starting with, not to get completely off the subject of this project, but having a consultant review criteria for the green pavement markings and how we would go about that treatment. So we don't have anything to report yet. It's something that we have on our work plan for this year. If there's anything that comes out of that we could implement with this project before construction, that we would do that.
Okay, thank you. Other comments or questions on these plans?
Hey, Kuzmiak, MMTC. I had another question here. Jake, I seem to recall at one point there was like a railing that was required for certain parts of this path. Is that, I don't know if I'm recalling this correct, but I feel like we had a conversation over just the rail issue, which is kind of new to me. I don't see any of those in the plan. So either, am I remembering incorrectly, or did something change to not require those anymore?
Jake Baldwin, Engineering Program Manager. I don't know if you're thinking of our 29th Street in Delaware with the Lawrence Loop project. That's where the shared use path is less than 2 feet from the back of curb, then we're required to have a railing. I don't recall the specifics. I know we do have a few pieces here adjacent to the back of curb with just sidewalk. But yeah, we're currently not showing any railing in the plan.
That makes sense. So I guess where you had the least amount of room to work with, it wasn't going to be an SCP anyway. It was just going to be a sidewalk. So therefore, you don't have to have a railing there, I guess.
Yes, per the guidelines.
Okay, thanks. Nick Kuzmiak, MMTC. I had kind of a broader question here. I feel like we've probably gone over this before the last time we talked about this project, but I can't remember all the details. So I was hoping somebody could remind me. Did we maybe ask and explore about going down to just a single lane and putting a protected bike lane or SCP on Naismith? I was looking in the GIS that was prepared for MMTC folks, just try to see if I could kind of suss out traffic counts and see if there was maybe, was this like a major arterial, or is it just kind of large and doesn't actually see that much like traffic? I couldn't really tell, and obviously it's way too late in the design phase for this one, but just kind of, I'd be curious to know the opportunities in the future for road diets where there is maybe a possibility for that. So I guess in terms of what answer I'm looking for is, how can we sort of bring this point up in the future at the portion of the design where it's actually appropriate?
This is Dave Cronin, city engineer. With this specific project,
it's kind of more geared towards completing the missing sidewalk gap. And so we didn't really have a discussion on, well, we're not putting in just the bike facility, which you could potentially do if you were to reconfigure the lanes and have an on-street bike facility. So this is more of a, both a pedestrian connection that was identified as a need through the AIC KDOT grant, transit grant that we got to do the project. And since this segment is on our bike network, we had that discussion with this with the MMTC back, I think, before we submitted the application about increasing the width to a shared use path, just to also get at completing that gap in the bikeway network. So when the street project proceeds with reconstructing the street, we could have a conversation on the lane widths and if we want to have some other sort of bicycle facility at that time. But we didn't have that discussion or debate with this grant project that we got.
Thanks. That makes sense. I guess in future projects that involve kind of road reconfiguration, yeah, that's a more appropriate time to bring that up. So sounds good.
Other questions or comments? All right. We're ready to move on? Looks like we are. And we don't need a...
I would ask, for Commissioner Collette, this is Dave Cronin, public comment.
Oh, yeah, I see that now. Thank you. Go ahead, Michael.
Hi, good evening. Michael Allman with Sustainability Action Network. I think this looks really good as far as it's come along so far. And I really appreciate the commission encouraging, I should say, engineering staff to be creative in this, as Commissioner Evans pointed out. Sustainability Action has been pushing for a shared use path in this area of what right now is a goat path for about 5-6 years. And it's good to see that engineering staff has figured out a way to do it. As far as Commissioner Kuzmiak's question about the right sizing of the street from 4 lanes to 2 lanes of motor vehicles, at various times in the development of this project, the 19th Street Neighborhoods Coalition has indicated opposition to a right sizing of this street here with on-street bicycle lanes. First of all, being that white stripe bicycle lanes are not particularly safe, but mostly because the coalition is concerned about mostly like game day traffic, but traffic in general going on 19th Street, which is highly residential type of a street, even though it's classified as a collector. So we want Naismith to remain 4 lanes, so much of KU traffic continues to 23rd Street, which is the arterial. As far as green pavement markings go, I could point out that Sustainability Action Network proposed specifically green pavement markings in this section in the 2022 Capital Improvement Plan, and engineering staff and the Budget Review Committee rejected that. I don't know why. I'd be curious to find a reason why that happened, but we proposed it, and it's right there in the CIP listed as unfunded. Green pavement marking should also be across 19th Street as long as we're doing it. That's probably the most important green pavement markings that could go in this. And I had a question about the right-of-way acquisition between, let's see, 19th Terrace and 19th. The right-of-way from curb to the property line is about 10 feet. So I assume that's an area that you're talking to that apartment property owner. But south of there, from 20th Street to 19th Terrace, when the street itself is reconstructed, I would assume also, and I like answer to both of these, I assume I think it's about, let's see here, 18-foot wide median would be narrowed to accommodate a wider space for the shared use path on the side. Now, are my assumptions correct from 20th to 19th Terrace and from 19th Terrace to 19th Street? And thanks for the opportunity. Thanks for a good job.
Thank you, Michael. Jake, can you answer those questions, or in terms of those two segments that he just asked about?
Jake Baldwin, engineering program manager. Michael's correct on the north side of the apartment complex. Yes, we would attempt to acquire easement as necessary to construct shared use path with this project. In terms of the block there between West 19th and to the south, narrowing the median, I think that would just be an option that's considered during reconstruction. I don't think we could say one way or another if that's the definite way to go at this point.
Thank you. Other questions from commissioners? Carol, go ahead, please.
Commissioner Bowen, I believe I heard Michael Allman say something about a project on the CIP list. Why did we never see it? If it was something green marking, I don't remember what it was, but I just got hung up on why wasn't it passed by this commission?
This is Dave Cronin, city engineer. I believe there was...
Mr. Allman had submitted a project through the city's CIP process, a citizen request. And that process can include transportation projects or any other capital improvement projects, those requests. And so the citizen requests that were received were scored using the prioritization guidelines that were developed a couple years ago against all other projects. And those scores were used to prioritize the projects in the recommended CIP. So the MMTC does not review the citizen requests for CIP projects. If it was a bike ped specific project, those sorts of projects, have been coming to the MMTC. MMTC is part of that program and the prioritization of those projects, but this was submitted through the city's CIP.
Commissioner Bowen, I think we are such a new commission that we need to be rethinking some of the processes so that the commission is involved with transportation decisions.
Dave Cronin, Commissioner Collette, if you're trying to speak, you're on mute.
Sorry. I just asked if there were other comments. All right, let's move on to the next item on the agenda, and that is recommend approval of the updated Lawrence Safe Routes to School plan.
Yeah, Jessica Mortinger, Transportation Planning Manager. I'm going to take a second to share my screen. This is a memo that was included as an attachment in your agenda packet. And we wanted to call attention to the fact we have been notified of the decision earlier this year of evolving Kennedy Elementary into Kennedy Early Childhood Community Center, and thus dividing the current Kennedy students between Cordley, Prairie Park, and New York. We were provided a few weeks ago from USD 497 anonymized student addresses, so we could be able to evaluate the density of clusters of students that are attending each of the new proposed schools, to evaluate them in the consistent format with the Safe Routes to School working group that we did during the Safe Routes to School planning process. We followed really the trend of what we would anticipate would happen under a future school area traffic control policy, recognizing this change is happening before that policy can be adopted. And so through that process, we are bringing back consideration for your approval, this update to the Safe Routes to School planning process. Out of the schools, only 2 of the new schools that students will be reallocated to had student densities that extended far beyond their current route structure. And so here you can see Prairie Park and Cordley's existing routes in black, the routes that were pre-Kennedy changes, including the Kennedy routes in this central area. Based on what you can see in the underlayment and the change of the boundaries. This pink area is going to Prairie Park to the south, and we are proposing the addition of this routing to get students into that school. And up 19th Street to the west into Cordley. Based on those proposals, these are the recommended removal of previously Kennedy school projects from the Safe Routes to School projects list, a modification of this bike project, noting that it was a Kennedy project and it would still remain a Prairie Park project, and then the addition of these projects to meet the goals within the Safe Routes to School plan of sidewalk on both sides for collector and arterial streets, and sidewalks on one side for local streets, although there was no local streets added in this. They're all collector and arterial streets. So this would probably be the second side of many of these you can see here in terms of adding for these 3 sidewalk sections. So those would be projects that after adoption by City Commission and that your consideration would be added to scored projects in non-motorized prioritization. This amendment also includes language change requested as part of our continued conversation with USD 497 in our process to work through the establishment of a memorandum of understanding between the City of Lawrence and USD 497. There's concern from school board members that they believe that this Safe Routes to School plan is the city's responsibility when they elected not to adopt the plan in January of 2015. As a result, in trying to formalize the working group, they are concerned that there are recommendations included in the plan that use the language that USD 497 should do something, and they have requested that those shoulds be changed to shalls so we can further progress with some amended language in a proposed memorandum of understanding to move forward into a formal agreement to work together to some of the mutually beneficial challenges and goals in the Safe Routes to School plan. And we believe that's in all of our interests to continue moving forward on that. And since it's not a USD 497 adopted plan, there's nothing that changing this language should impact in terms of our ability to continue to work together. We viewed kind of all those future decisions around funding and policy recommendations, regardless of separate conversations and decisions we would need to have through the working group and then each of the structural processes for decision making. This chart provides a summary of all the pages that will be changed as part of the changes that are described in this summary. And then each of the pages, you can see here the old and new maps. Removal of Kennedy School as a listing. And I won't necessarily go through all of these, but every place we've revised where we could, the references to area boundaries, students, density, routing for this plan update. I'd be happy to entertain any questions you may have about what we're proposing tonight as this school, this Safe Routes to School plan amendment.
Thank you, Jessica. This is Pat Collette, MMTC Chair. The MOU that you referenced, is that the same MOU that we're working on for the crossing guard decisions? Was that, or is that a separate MOU?
Jessica Morton, your Transportation Planning Manager. There's only one MOU.
Okay.
There is no MOU specifically for school crossing guards. The MOU that we're trying to establish is to formalize the working group that was created around Safe Routes to School planning when we began this plan development process that the MPO led the last few years. We've had an informal work group and we've wanted to formalize it. Mm-hmm. You'll notice also in the future conversations around school area traffic control policy, which we'll bring back in August, that there are some references to that formal working group that we hope to establish that have a role in some of those Safe Routes to School processes.
Okay, great, thank you. When I looked at that plan, I looked at it fairly quickly in terms of the changes of the routes and such, but was there a net increase in terms of the mileage for routes? It looked like there was an increase overall.
There's a small net increase.
Okay.
I think the memo said the exact number. I'd have to go look. I don't recall it off the top of my head at this moment. But as far as that's concerned, I think we've never capped the so it removes 1.5 miles of Kennedy routes and adds a mile to Cordley and a mile to Prairie Park routes. So some of those are the same segments. So it's not removing, some of them are stay, but that's kind of the net. So there's a net increase of about a half mile of routes. We've never really set a cap on those routes. We've tried to establish routes where there's a reasonable expectation that students would feed in with there's enough density in that school within the school population for each school that the students would feed in kind of in a walk-shed fashion to prioritize routes for gap infill and for other improvements where we can expect a larger number of students to be walking or biking. But we've never had a cap. We didn't say, oh, it could only be this much per school or anything like that. We just tried to find what's the appropriate network to make sure that we had a primary function established.
Yeah, that seems like a reasonable and good approach. Yeah, thank you. Other questions or comments from commissioners? Carol, go ahead, please.
I have a question on, well, it was kind of a policy that was discussed early on when the commission on the radius of curvature, and of special concern was the radius of curvature on corners by schools, because when you round off those corners, when you smooth them out, cars creep around the corner and they're not looking at pedestrians. I'd like to bring that up again. I don't know if it's a policy or a standard or what it is, but I hear we're going to be doing some more intersections because of this, and I think we need to be aware of it.
Other comments?
Charlie Bryan, MMTC. Jessica, I was wondering on the table, percentage of students by distance from school. I see that Kennedy Elementary will be removed. How does that impact the percentage for the other schools that are going to be impacted? Or is that data not available yet? Like Prairie Park already has about 40% of students that live within 1 mile. And I'm assuming it's going to change that. So it'll be a bigger percent that are further away.
Yes, I think that's possible. Jessica Morton, your transportation planning manager. We prepared this after getting the data from the school district and only had a couple weeks to do that, to get that prepared. I would anticipate we'll update those analysis because we're tracking some of that understanding in relationship to seeing how changes in percentage of students walking and biking comes in the student data. I think that will be particularly important for some of those schools that we would anticipate maybe seeing a change as a reality of the fact that some of those students, a larger percentage, possibly live farther from school now.
Thank you.
I think that will be a continued reality of boundary conversations.
Other questions or comments?
Kuzmiak,
Yes.
MMTC. So Jessica, when you were talking about the changes to the text, I was a little bit confused because I thought you said things went from should to shall, but in the text it said from shall to should. So I guess the first question is, which way is it? And then the second question is, could you give a little bit more detail on what those clauses were? And the reason I ask is because after talking about the crossing guard thing, where in the school district benefits from something that the city pays for, but the school itself does not actually pay into or contribute and actively blocks volunteers to become junior crossing guards, I kind of worry a little bit about letting USD 497 off the hook for something that very clearly benefits them.
Yeah, Jessica Martin, your transportation planning manager. I've only just briefly reskimmed the conversation, but there are the USD 497's particular concerns, and it would be the plan currently says shall do in regard to a few statements around USD 497, and those they would like to say should, in the sense that they haven't adopted the plan anyway. They haven't committed themselves to implementing safe routes. In the same and we're working to try to get everybody to the same table and for a formal working group. And we feel like that's our biggest interest. But you're right that school crossing guards it has been, and I think will be, and we'll probably talk about it more with a little bit with the next item, but also in next month, that I don't think, regardless of if we have shall or should in this plan, because it's only the city that's adopted it, that we would be able to tell the school district that anyway. These are all going to need to be, each of the policy decisions that are recommendations in this plan require additional work to make progress on implementing. So the conversation we're having about school area traffic control policy is one example of that. Of course, if it says shall and it's something that the city shall do and we're working on implementing it, then it has a little bit of a different context because the city has adopted that plan legally. And so I'm not sure that in order to move forward, I think it's in our best interest to make those changes. I'm sure you're right though, the idea of cost sharing, that's one of the ideas in the plan that I know that USD 497 is not necessarily interested in, although it's something the working group proposed as an option. Also volunteer guards, that's another one that we proposed as an option to fill gaps. Particularly, it's something we asked parents about. If the expectations for guards exceeded the warrants or the financial capacity for the program, would a volunteer program be eligible? And USD 497 school board members have expressed no interest in operating a volunteer-oriented program or the capacity to do so. So I think those would need to be continued conversations as we move forward if we want to make progress on safe routes to school.
Excuse me, MMTC. So I just want to make sure I understand. It sounds like then the idea is that we really just need to get them to the table first, and these concessions are kind of that way to kind of ease them into a more formalized working group. And then at that stage, ideally once they realize that they are stakeholders and they should contribute, perhaps then we can convince them to kind of chip in their fair share. But at this point, that might be pushing a little bit too hard then.
Yeah. Jessica Mortinger, Transportation Planning Manager. I think we need everyone at the table, and we believe a formal agreement helps us formalize the process that we have loosely been working under during plan development. We believe that formalizing that and bringing them to the table in that way and under a legal agreement brings more validity to the fact that we are all players in responsibility, have varying responsibilities with safe routes to school.
Okay, if there are any other questions, if not, I'd entertain a motion to recommend approval of the updated Lawrence Safe Routes to School plan.
Charlie Bryan, MMTC. I move to recommend approval of the updated Lawrence Safe Routes to School plan.
Thank you, Charlie. Is there a second?
I second. Bowen.
Thank you. Okay.
Pat, this is Steve Evans. We need to catch our public comment before we take that next step.
Okay, yeah.
So if you could just back up a little bit. Michael's got his hand up.
Yeah, thank you. I didn't see that. Thank you. Michael, go ahead.
Hi, thank you, Commissioner Evans. This is Michael Allman. I'm trying to understand the terminology in the chart of which projects are deleted, which are modified, which are added. Two particular ones, B21 and B23. B21 Harper Street bicycle, and then B23 Haskell Avenue bicycle. And the comfort level for bicyclists of 4 or 4 and 5. What is the explanation of what's going on there for bicycles? I mean, is it going to be widened to a 10-foot wide shared use path? Hopefully. I'd like to see that. And I just want to know what you have in mind there, because there's definitely right of way in both cases to do that. So if somebody could clarify that, I would appreciate it.
Sure. Jessica Mortinger, Transportation Planning Manager. So in this Safe Routes to School plan, it was the first time we added bike projects, and we explored opportunities where the bikeway network overlapped with safe routes, and it was prioritized network components. We saw identifying them in the Safe Routes plan as the opportunity to open up their eligibility for transportation alternatives funding from KDOT for Safe Routes to School projects for bike projects, which we have not yet done. There is not a specific facility type identified there yet. As you know, when we put those projects in the non-motorized prioritization for bike projects, we look at those level of comforts, which are 4 and 5. Those are the current level of comforts. And so under the bikeway plan, we would be looking at 3 or lower. And so most likely, because of the nature of both of those facility types, you would be looking at separation, likely major separation. So cycle track or shared use path would be likely, although those will require engineering analysis to decide appropriate bikeway types as those projects are costed and prioritized in the non-motorized prioritization list. Hopefully that answers your question, Michael.
Yeah, that does. And I applaud you for very creative funding exploration from KDOT. KDOT should be paying for a lot more of our stuff. Thank you.
Yep.
Let's go back to the motion. We have a motion from Steve Evans, correct? And a second from Carol Bowen.
I think Charlie actually did the motion.
Charlie? Yeah, I'm sorry. Yeah, Charlie. And then second from Carol. And we can Josephine, can you do the roll call for approval of that?
Josephine Gonzalez and myself. Steve Evans. Oh, I'm
Aye.
sorry. Okay. Nick Kuzmiak.
Aye.
Aaron Payton.
Aye.
And Patricia Collette.
Aye.
You get Carol.
And Carol.
Sorry, seconded.
Aye.
Still need to get Carol.
Oh, I'm sorry, Carol Bowen.
Thank you. All right, let's move on to the item 3. Recommend the temporary relocation of the adult crossing guard from Harper Street and Davis Road to Harper Street and 23rd Street, pending authority in the 2022 budget process, and require further evaluation after the 23rd reconstruction project is complete.
Justin Smith with MSO. So this is kind of
the second part of what we're talking about here with Kennedy transitioning to an early childhood center from an elementary school. So we just talked about how we had revisited our safe routes associated with those impacted schools and just approved that, or approved recommending that. So then this part is the adult crossing guards. Currently Kennedy has 2 guards, one at 19th and Harper, one at Harper and Davis. And so this item would recommend maintaining the existing crossing guard at 19th and Harper, because as we noted in the previous item, we extended the safe route to accommodate students north of 23rd Street to make it to Prairie Park now instead of Kennedy. And so this guard would still serve that safe route at 19th and Harper, because the route continues east on 19th from the intersection. And then we're also recommending a temporary relocation for the existing guard at Harper and Davis, which is kind of right in front of Kennedy right now. Helps cross students across Harper right in front of the
school. And so we recommend
temporary relocating that guard to 23rd and Harper, signalized intersection for the students that are now going to Prairie Park that are going to have to cross 23rd Street. And we would then reevaluate that after the reconstruction of 23rd Street is complete, which is anticipated to begin this fall and would continue probably into the 2022-2023 school year for the construction project on 23rd Street. So then we would reevaluate after that. I think those are kind of the details I wanted to cover. I'll see if Jessica wanted to add anything before we take questions.
That looks pretty straightforward. Any questions from commissioners or comments?
Charlie Bryan, MMTC. I'm just curious about the fiscal impact statement. I'm assuming this is something that if it occurred, it would begin in the fall. I mean, the beginning of the school year. So wasn't the crossing guard already accounted for in the 2021 budget? With this, I guess is that statement saying that if it's not approved in the 2022 budget, the money won't be expended this year either?
Jessica Morton, your Transportation Planning Manager. I think that's where we would have to negotiate with parking staff to evaluate the situation. Ideally, this is cost neutral because these 2 guards existed, and our budget year is on a calendar year, whereas their school year is a split. So I think that's a conversation we'll have to have depending on the decision. I think we wanted to get this addressed, right, in regard to Kennedy School, but recognize that there is still the crossing guard, adult crossing guard portion of the school area traffic control policy, and then which could make financial impacts to both 21 and 22. And secondly, both up or down, depending on the conversation, right? And then there is the reality of what happens in the city budget process. So I think there's 2 things that could impact it.
Just to clarify, is the expectation that a crossing guard would be in place in the fall, regardless of the 2022 budget? Or would it literally be contingent on the 2022 budget, whether there's someone there this fall?
Well, I guess you could make that, Jessica Morton, your transportation planning manager, you could clarify that in your motion. I think our intent was if they commit to it in 2022, it would be for the school year for 21 to 22. But you can make that clarification in your motion if you'd like.
Okay, thank you.
But there's definitely funding in there for the fall of 21. Is that what you're saying? I mean, because that was just moving, that funding had already been allocated for
correct
Harper and Davis, and it's just moving now to 23rd Street. Okay. So the question is, what happens after January of 22? Okay. Are we ready to make a motion to approve this change?
Is there any public comment on this?
See any?
Well, I'd like to have some more discussion before we vote, if that's possible.
Okay, go ahead.
I was just trying to get the questions out of the way. Charlie Bryant, MMTC. I'm really, just to go deeper into why I asked the question about the budget, it feels like that's just a bigger question. If there's a budget issue that this program needs to face, I guess it seems premature to decide which location gets cut. That's why I'm just kind of struggling with this one. I would think that crossing 23rd Street would be fairly significant concern to a lot of parents that have their kids walk into an elementary school. And, you know, if there's already funding in the 2021 budget, I'd hope the very least we'd do is move the crossing guard that's already funded, get some data to kind of identify whether kids are actually crossing with the crossing guard in place. And then if the funding's cut, look at the entire system of crossing guards and figure out what's the best, strategy to go forward.
Yeah, this is Dave Cronin, city engineer. I would just chime in and say we don't have any indication that the budget will be cut.
The program, and this decision is not in relation to the budget of the program, just an action that we wanted to take ahead of the fall school year to move the existing approved school crossing guards, the one to the 23rd and Haskell, and then retain the other one. If, in the future, whether it's next year or beyond, if we need to prioritize the crossing guards based on the budget, there could be a conversation on the need and the priority of all of the crossing guards and which ones are most important, but we're not there yet. We're not there tonight. So I think at the next meeting, we're going to bring back some criteria to help evaluate all of the crossings or kind of better stratify or rank them based off the conversations that we received at last month's meeting. And then just depending on the budget for the program, that may impact how many crossing guards we can fund, but we don't know that at this point, and we're not making any of these recommendations based off potential funding. We just wanted to note that in the fiscal impact that just because we're moving the crossing guard there doesn't necessarily mean it shall remain there in perpetuity. It's all based off funding, but our intention is to have it funded.
But Charlie, is your point that really in terms of
signaling in the fiscal impact statement that this one is contingent on funding. It really is the entire program that's contingent on funding level. And so that we don't that statement of fiscal impact isn't necessarily tied to this particular location. And that would be a discussion, at next month's meeting in terms of overall, overall crossing guard program. Is that what you're getting at? That having that fiscal impact for that one particular intersection is pulling that out from the rest of the mix in terms of prioritization.
Charlie Bryant, MMTC. I just want to make sure that we're clear that the questions around whether there's a change in the crossing guard budget, that ought to be considered in its totality. Feels to me like what we're really recommending is moving a crossing guard from one location to another. And no one would assume that also suggests that they have some special status to get funding. I think equally they shouldn't have some kind of temporary sense that there may not be funded. So perhaps I'm reading too far into this.
Yeah. Well, but
I think the important part of the recommendation that's proposed is that the relocation occur and that data is used to evaluate, the importance of that location.
Yeah. Perhaps the motion could strike that pending authority in the 2022 budget process. Would that get at your question?
I don't know that it's necessary. I just want to be clear, like if this comes down to a decision that's predetermined because the budget gets cut, I'd hope we would all kind of have a broader discussion. Yeah. That's all.
This is Dave Curran, city engineer. We would be perfectly fine with removing.
Removing the pending authority in the 22 budget process. The intent of this action's to move the crossing guard and reevaluate it on whatever criteria we land on with adult crossing guard criteria in the future after the project's complete. And so. I would be fine if removing the pending authority in the 22 budget process from the action.
Okay. Carol, did you have a comment?
Yes, I did. I think maybe it's kind of the same thing that Charlie was thinking about. I watched the last meeting, the June meeting. It was very interesting, a lot of good discussion. But I walked away thinking, walkers are the most vulnerable form of transportation, and children are the most vulnerable of the vulnerable. Why are we being so stingy in making it safe for them to get to school? There's something wrong with our philosophy. And it's not our commission, it's just the way things have played out. And we need to reverse it somehow because it just doesn't sound right.
Thank you. Would someone like to make a motion?
Charlie Bryant, MMTC. I move to recommend the temporary relocation of the adult crossing guard from the Harper Street and Davis Road to Harper Street and 23rd Street and require further evaluation after the 23rd Street reconstruction project is complete.
Thank you. Is there a second?
Kuzmiak, MMTC. I'll second the motion.
Thank you. Josephine, can you call the roll?
Okay. Steve Evans,
Aye.
Carol Bowen,
Aye.
Nick Kuzmiak,
Sorry. Aye.
Aaron Payton,
Aye.
Patricia Collette.
Aye. Thank you.
Thank you.
Okay, item 4, discuss a hybrid meeting format to allow MMTC members to attend in person for future meetings. Dave, would you like to address this?
Sure. Dave Cronin, city engineer. So the city commission has begun meeting in what we're calling a hybrid meeting format, which means that they are attending in person. And so we have here in the city commission room, it's set up so that at the 5 city commission seats, there's a camera so that as they are here present at the meeting, they are also interacting virtually. And so we are going forward with maintaining a virtual option for the public, for public participation, and a virtual option for staff that is presenting items with the city commission. And wanted to have a conversation with the board about get your thoughts on a hybrid meeting format. The one thing I would note that's a challenge with the setup in here is that it is just set up for 5 commissioners. So if we if the board would like to start meeting in person or attending in person, if more than 5 wanted to do that, we would need to work out a plan to alternate between months to make sure that we don't exceed 5 commissioners here in person. And so I think I haven't had anyone express to me the need to be back here in person. And generally we've, I think as time goes on, we'll continue to work out, how we hold meetings with the boards and see how things go to see if there's any other way to get more commissioners in here in person in the future. But for now, the room is set up so that we could have commissioners here in person. We, with the policy of City Hall, and you'd be required to wear a mask if you're not vaccinated, and same as with individual members of the public that attend the meeting in person. But other than that, I think generally speaking, I think the recommendation for boards would be to continue meeting virtually. I think it's worked pretty well, and we will still be providing virtual options going forward for members of the public to participate. Just I guess wanted to get thoughts from the members on your thoughts on wanting to attend in person or continue on virtually. And so we're calling it a hybrid meeting format, which so we're still we'll be broadcasting the meetings over Zoom regardless, but we do have the ability now to have in-person for the commissioners to attend these meetings. So wanted to just have a discussion on it since it's kind of started, I guess, last night with the city commission meeting. So I guess
this is Commissioner Evans. Dave, like the situation you guys have, there's the I guess the panoramic view where we see the 3 of you at the table, and then when you speak, there's the ability to zoom in to the individual that's speaking. Would that be the case if there were 5 people there, or would you pretty much be looking at the view that we see, which is the panoramic view of you guys on the table?
This is Dave Cronin, city engineer. I believe you would see the view, if it was a a multimodal transportation commissioner here in person, you would see the view from the camera. It could be both. We have, Kurt's in here operating the camera for the room, and so he takes different shots of people as they're speaking. So I think it would be either a shot from one of the cameras here or the camera that's on the computer. So it would probably be a little different than just, right now everyone's just using their own camera. So I would, I don't know if that answers your question or not, Steve. I think you would still, we would still see you on the Zoom screen with the camera here at the, that's up on the podium or at the desk. But the panoramic picture would be probably pretty similar to the way it is.
Well, my 2 cents would be, I think we should all be live or we should all be on Zoom. And I think if I were trying to facilitate the meeting, probably ask Pat what her preference may be, but I think it would be more difficult to keep everybody on the same page and keep the communication consistent if there were two different media, more or less.
Yeah. Technology wise, I'm sure it could be handled, but I'm just thinking about the logistics of, who's going to be there in August and who's going to be in September. And as people's, at the last minute can't attend a meeting, and so they plan to be in person. My preference would be to continue with the Zoom meetings the way we have been until things shake out a little bit more and we know, if we can all be in person again. But certainly, if someone really prefers to to be in person, that probably could be accommodated. It's not sounding like all of us are going to, be vying for, time at the in person. So, but my preference would be to continue with the Zoom meetings for now. We don't, with the Delta variant and those kinds of things, we don't, I want to make sure we have processes in place that we can keep with, and if we change it and then we have to change back, I would just as soon keep it the way it is. Any other thoughts from commissioners about your preference?
This is Charlie Bryan, MMTC. I appreciate the effort the city's making to provide kind of a move back toward what we used to do. And I think we need to, I think we need to be responsive to that. So I'm more inclined to say, let's go forward and try to do this. I know that, not everybody wants to be in person, so we need to accommodate everybody. So if our group doesn't want to do that, then that also is fine. But if there are some members that want to, I think it's probably time to let them have that option. I was kind of wondering, more of a technical question. When I'm looking at the panoramic, it looks like anybody that's sitting at the commission table would be looking at the backsides of staff. And would that be the arrangement, or would you turn to face the MMTC members?
Yeah, this is Dave Krohn, city engineer. The arrangement would be the same. I don't know if necessarily I think whoever's running the meeting would be here facing the front. Staff could be on some of the side tables, but there would be someone here at the table. So the room arrangement would not change from board to board. So that's, as we start start out with this, and we just have the 5 seats at the desk behind me with the cameras and this layout. That's the kind of the arrangement that we're trying to keep, because there's so many different boards with so many different number of members and needs, and we're trying to be consistent based off the technology we have in the setup. So there would be at least one person here, 1 or 2 at these desks, and then potentially other staff could be at some of the side tables.
Well, I think it'd be, I don't know how difficult it would be to have staff facing the MMTC members, but that would feel less awkward for those of us that are coming back to in-person. And then maybe it's just a matter of adding another camera so you can face the MMTC members and the camera is still facing you. I don't know. I didn't pay enough attention to the city commission meeting last night. I know they were doing it and I was watching for a while, but I didn't see a panoramic shot for the period that I was watching it.
Dave, did I hear you say though that the city commission was recommending basically that advisory committees continue virtually, or did I misunderstand that?
This is Dave Cronin, city engineer. I don't think it wasn't the city commission was
recommending it. I think our communications group, as we start out with seeing how it works, kind of said, if it's been working well, have the discussion with the board. But if it's been working generally, we'd recommend staying in a virtual option. But we are open to, if there are members that want to be here in person, we have that ability now, and so if I think it's been working well, and so if we don't have to make a decision tonight that will lock us down into virtual for the rest of the year, we can wait another month and see how it's working and see what other boards are doing and how it works and revisit the discussion. But since it is an option, just wanted to kind of throw it out on the table. And I would say that I think logistically it's easier for us to organize with having more than 5 members on our board, that if we were to meet in person, there would be some organization on who's meeting this month in person, who's meeting next month, and keeping track of that. So for those reasons, I think we would recommend continuing virtual.
Charlie Bryan, MMTC. I guess I don't imagine that we're going to have a problem with that. So to me, it seems like if you have someone who wants to be there in person, there ought to be an accommodation made for them. If all of us want to be there, that's when you're going to have a problem. From this reaction, it doesn't sound like that's an issue. And, there's only 9 of us. So when there's suddenly 5 of us there, I guess you'd have that problem. So in my head, it's like, it doesn't hurt to say if someone wants to do it, they can go in person. If it's more convenient, their internet works better, to be there instead of at their home, or for whatever reason they would rather do the work at City Hall.
Well, this is Steve Evans. I'm personally not anxious. I'm anxious kind of, I don't know what I'm trying to say here. It'd be great to be able to go back and be live with everybody. Personally, I'm not enthused or anxious to get back there. So I would probably choose to wait a month or 2 before I would want to go and sit at City Hall. But I agree with Charlie. If somebody wants to, they ought to just go and do it. And we might learn if 1 or 2 or 3 people wanted to, it might end up being a good thing. We're not going to know it unless somebody tries it, though. So be my guest.
Well, what I would say is if that's the case, and just to provide advance notice to David, so that if there were a circumstance where there more than 5 people, that could be addressed to make sure that didn't happen. But I don't anticipate that happening. Any other comments from people? But
It's come
again,
first served. Yeah, but you get there late, you don't get a spot.
Yeah. And like David said, we can revisit this again, so, I mean, kind of month by month to see how things unfold as well, so. All right, let's move on to staff items.
If we could go back and receive public comment on that, Commissioner Collette, on that last item.
Okay, yeah, sorry, didn't see that. Yes, please go ahead, Michael.
Hi, thank you once again, Michael Allman. Just speaking for myself, I was at the City Commission meeting in person last night, so I have a couple observations that may be of value to you. I'm not sure. The hybrid system really isn't fully operational yet. It's operational if there are 5 members of a board or commission. But if there are more than 5 members for a board and commission, then there are technical limitations. So it's not really, it's not really there yet. You might want to wait until they have 9 microphones operational. But as far as the technology goes, I wasn't able to see the Zoom screen because that was facing the commission away from the audience. So I'm not sure how that worked necessarily in your interaction from people in the room communicating with people in Zoom. However, the staff table to the right side that faced inward so that the commissioners up on the dais could see those staff members, there were 4 seats at that table that could accommodate 4 members of the staff. The city manager was there and the city attorney was sitting there. But the city clerk was sitting with her back to the commission. And I'm not sure why they decided to do that, but well, she had to directly interact with the Zoom screen. That might be the reason why. Because she basically conducted the functionality of the meeting. And one thing about the audio, when people who were not there in person, like Mr. Cronin, who was there by Zoom, when he commented by Zoom, when I was in the room listening to what Mr. Cronin said over the speakers in the room, it was very distorted. I had a hard time understanding what he was saying. But when I listened to the meeting, the recorded session by Zoom, the audio I heard through my earphones of Mr. Cronin was very clear. So I'm not sure if the speakers in the room will accommodate really good communication between live and Zoom. And that's why I say, it's really kind of not all there. So just take that into consideration, just from my own observations.
Thank you, Michael. That's helpful. All right, let's move on to staff items. Talking about the facility.
Yep. Dave Cronin, city engineer. Just wanted to note here on the agenda, since we did originally intend to have this discussion at tonight's meeting, that it is those items being deferred till next month. So that's also reflective on the calendar. So the discussion for a transit facility option for the hub at Bob Billings and Crestline, and the downtown transfer facility will be on the August 2nd meeting. That is all that I have on that.
Thank you. All right, commission items. We'll start with PTAC update.
Is that you, Nick?
Nick Kuzmiak, MMTC. I suppose it is, although I see that Adam Weigel's on the call as well, so he may be the better person to update us. If you want a quick soundbite, at this point, we're still looking over the details of the Transit Center project and are hoping to approve it soon. So that's all I know. But Adam, if you want to jump in with something that I've completely forgotten, which is likely, feel free.
Adam Weigel, Transit and Parking Manager. That's the primary piece we're working on. We've got a number of irons in the fire. Something the group may be interested in soon. We're looking to deploy mobile transit fare payment. So the ability to get pay for bus fare through your phone just as an additional option for people. So that will hopefully be coming through in the next couple of months. We're working on contract issues right now, but yeah, facility is top of mind.
Great, thank you. And then Transit Redesign Committee update. Adam, you want to talk about that?
Sure, Adam Weigel, Transit and Parking Manager. So we are in kind of the first third of that work. We have a survey that's been out for a little over a month now. It will close this Friday. We've got close to 500 responses. We're pretty happy with. But the survey that's currently out is part of a number of outreach efforts we've done to try to understand how people currently use the system and how they view some key trade-off questions that we've been asking. Some trade-off questions that really do constrain us on a daily basis. More frequency versus more coverage. Fare-free service, or fare-free service that would include some needed service cuts, or keeping service levels where they are without achieving fare-free service. So really putting some of those difficult trade-off questions in the hands of people in the community to try to guide us on what first iterations of service scenarios might look like. So once that survey wraps up at the end of this week, consultants at Foursquare has been working on a number of technical analyses using census data, ridership, a lot of the qualitative data that we're getting through the survey to present service scenarios that then I think will elicit a lot of interest and reaction from the community that will help us kind of massage that into what would be the final preferred concept that will likely be some version of a hybrid, whatever scenarios come out over the next couple of months. That's about where we're at on that project. I know Carol and Charlie are on that group. So any other thoughts from your experience on the steering committee?
Charlie Bryan, MMTC. So the last meeting, mostly the conversation was around the survey design and those trade-off questions. I'm kind of excited by that because it asks a lot of good questions around, like, would you rather have this or that? And it doesn't imply that one's better than the other. So it'll be interesting to see how what the public perception is around kind of the relative merits of, more frequent service versus longer hours, Sunday service versus longer hours, or just kind of throws out ideas we've probably all heard in the past, but we've never had the question posed, like, well, what's the trade-off? You can have it, but you need to take away something else, and be eager to see if within that constraint, if people would still want to see things like Sunday service or more frequent service, or not expanding into areas that are less well served. So I'm looking forward to seeing the results. That's all I can say in terms of that last committee meeting. I wanted to, since we're talking about transit under commission items, I just wanted to say I really appreciated the opportunity to do the walking tour of the transit facility proposals. And it was really instructive to especially get the feedback from one of the transit operators, specifically around the option 1A and 1B. And then, being able to look at the Crestline facility proposal location was also helpful. So I just appreciate Adam for doing that, making that available to PTAC and MMTC members. And it certainly stimulated a lot of discussion, from a few of us that were part of that. So I don't know if there's any future opportunity, but if you haven't taken the time to walk and look at the, places in the downtown area, that in particular, I think has a lot of, feels like there's a lot more complications in that decision. So it'd be worth just to stroll through downtown and bring your maps and think through how that decision should be, what we should recommend. Thanks.
Nick, did you have a comment?
Nick Kuzmiak, MMTC. The clap and the raising hand look pretty similar, and I've been confused by them before. I was merely applauding as well.
Okay, great. Thank you.
But while we're on me, I do have a quick one. I've been noticing over the past few months, and it may just be my perception and not reality, so correct me if this is wrong, that the study sessions seem to be declining in attendance. I have a feeling that it's probably not the subject matter because we've had some really cool ones recently, but it may just be availability of folks to actually make that time. Since we've had so much turnover over the past year, I wouldn't be surprised if maybe it's time to kind of rethink when and how frequently we have those study sessions. I for one can make it because I have a normal 9 to 5, it kind of works out well, but not everybody has as, predictable of schedules as I do. So I don't know how to address that because we only have, just a little bit over half of our members here in the first place, but perhaps there's a way that we can, I don't know, Dave, if you could send out a poll or something to kind of, try to see who is available when and, maybe if the frequency needs to change or something, I don't know.
Okay, this is Dave Kruns, the engineer. I can follow up and see if there's any.
I haven't had any indication from anyone that has missed a study session that it was the time necessarily, but I can poll the group and see if we need to make an adjustment in the future. Does anyone else have any thoughts on having a study session?
I kind of assumed it was, summer schedules, but I don't know that for a fact. It wouldn't hurt to communicate with the entire commission just to see if there's adjustments that we can make so that more people could attend, because they have been really rich sessions. I think it's, I guess the fact is people can watch those after the fact, and so at least they aren't missing out totally, but they're not able to ask questions and such during those study sessions. So, but yeah, it'd be good to follow up just to see if there's some better way to accommodate schedules if that's an issue.
This is Steve Evans. I have just a couple of things to add. I believe what Charlie said. We did hear from Amy from the planning department on the downtown master plan last month. And I noticed today that the steering committee is meeting tomorrow at 4 p.m. The comment that I would make about the downtown master plan and what's being proposed on the 800 block of Vermont for the transfer facility is it just doesn't seem like there's a lot of discussion between the two to come up with some ideas about what they mean to each other. In other words, I don't think that plan is coordinated with what the options are in the 800 block of Vermont. And I'm hoping tomorrow the steering committee, I know, was very active in looking at the public comments and asking for a little more time, I think a month or two, to get back to the city commission before the recommendation was made on the draft plan. But I think it would behoove us to also keep our eye on that, as it may relate to what we recommend or not in August for the 800 block of Vermont. And I'm glad Adam came back on, because he may want to add a little bit to the whole discussion that you may or may not have had with HLA, the consultant. I'd be interested to know a little more about that.
Sure. Adam Weil, Transit and Parking Manager. So we were consulted throughout that process and provided comment to draft plans as they came forward. I think a big piece of what we offered them was, and it was leading up to our consultant coming on board to look at options for the downtown area. I think the primary piece that we identified throughout that plan is that city-owned property, particularly city-owned parking lots along New Hampshire and Vermont, were opportunity spaces for transit services. Dating back definitely to the 2018 study, there has for a long time been part of the consideration of any improvements downtown to transit at not looking at like private properties. I know in some cases there's been brought up suggestions to use the Borders lot or the Journal World property that has been looked at for redevelopment. And that's just really not been part of the transit project improvements, to look at the investment that would take to purchase and demolish and redevelop larger private lots like that. So one piece of the coordination with the downtown master plan was just looking at feasible spaces that had the right amount of room, low entry fee as far as being city-owned properties, and then how parking can be mitigated through that. So that's a piece of it. I do think there are other pieces that we considered in the work that we were doing was desire for some public spaces downtown, particularly that 800 block options. You'll see some new community park space on the northeast corner of 9th and Vermont that would be incorporated if one of those concepts was advanced. So that's a piece I think that is a nod towards some of the interesting components that the downtown master plan wanted to look at. There's been a lot of efforts for comfortable bicycle facilities in the downtown area, so fully protected bicycle facilities, which can be hard to achieve with limited space. I think on that block, the two-way cycle track was one way that that option could implement something that would help in that regard and potentially set up for future extension of more comfortable bike facilities downtown. But I also think that the redevelopment prospects of parking lots downtown was a big thing that was noted throughout the downtown master plan. And in particular, that 800 block of Vermont is set up such that there would still be a lot of developable area there. The proposed concept for that particular block would not preclude a building or underground parking or parking garage or any type of a development like that could still occur given the way those concepts are laid out and the access to and from that area that would still remain. So those are just a few of the ways I think that we provided input and that we tried to see the proposals that we were looking at kind of mesh with a lot of what the downtown master plan was looking at doing.
Thank you.
Adam, this is Pat Collette, Chair MMTC. Has the steering committee weighed in on the options, on any of the options from the alternatives for the downtown transit facilities?
Adam Weigel, Transit and Parking Manager. Throughout the outreach that we did in April and then came back with actual concepts in June, we did not have specific meetings with the steering committee group there, but certainly had a lot of opportunity for people to provide comment. So I do hope that some of the steering committee members were involved in a lot of the different survey options and the in-person outreach we did. Hopeful that they got involved in that way, but we do not have a specific meeting set up with that group.
Thank you. Other questions or comments? Other commission items?
Commissioner Bowen, I missed the last meeting, but they were really good discussions. I had some notes like I always do, and they kind of accumulated on me. In the past, there was hostility between drivers and pedestrians and cyclists, and that seems to have subsided somewhat. And having been on this redesign route commission and some of the other ones, I'm thinking we should have some kind of a program that proposes best practices for the drivers, the cyclists, and the pedestrians, with no blame game, no who has a right for what, but just learning how to interact, because some of us old people might remember, but it certainly has been auto-driven for quite a while. And I was thinking things like if a cyclist is on a sidewalk, they should know that the pedestrian has the right of way, although we don't know that because we don't have any suggestions. We just say the state allows it. Well, that's general. We could always refine that, and it doesn't have to be an ordinance. We could just say things like the pedestrian should stop at the curb before they step out into the street, regardless of the signals. We could say cyclists, if they're going to use the sidewalk, should obey pedestrian rules. I don't even know, but just that kind of thing, so that everyone's part of this intermodal effort. That's just one of my wild-haired ideas. It came up at the last meeting, I think it was the last meeting, maybe it was this meeting, that we should have a public appeal process, and we should. It's come up a couple of times, but we don't have one, and we need to work through that. We need to work on a process for project proposals before the design stage. After the design stage is too late. We want to talk about what the actual function is going to be, how the concept fits in. We need to do that before we see a potential design, before a grant is written. We need to see those things ahead of time. On bus route redesign, the committee is made up of a lot of stakeholders. Senior Resources on there, the T is on there, Just Foods, a lot of different affected groups. But there's kind of a disconnect between that and bus route design. Because if we're really trying to teach people, encourage people to ride the bus who have never ridden one before, right now, a new design isn't going to help them any. It's just going to be something off there, somebody's doing something, and it's not going to encourage them to ride the bus. So we have to figure out how to communicate to these people. Some of them may not have web access. Some of them may not have a cell phone. Some of them may not even have cable TV. We don't know. But we cannot assume, we cannot have the answers before the questions. Okay, that's it. That's the end of my list.
Thank you, Carol. Other commission items? All right, I don't see any. Let's move on to the calendar.
This is Dave Cronin, City Engineer. So in August, we're back to meeting on Monday, which will be August the 2nd.
For the study session topic, we have the bike security and bike theft data. And on the regular meeting, as I mentioned earlier, the discussion with the transit projects, and then also bringing back the recommendation to approve the school area traffic control policy. And that'll include some revised information with the school crossing guard data that we discussed previously. So that will be part of that policy and that recommendation. And that is what we have on tap for August.
All right, thank you.
Well, it looks like we can entertain a motion to adjourn.
Charlie Bryant, MMTC. I move we adjourn.
Is there a second?
Steve Evans, second.
Okay. Seconded by Commissioner Evans. Oh, Michael, I got a comment?
Thank you, Commissioner Collette. Yeah, I do have a comment on the calendar, if I may.
Okay.
Back in February at your retreat, the commission indicated that you wanted to have a discussion about potential policies that you may want to entertain or initiate. And as I understood, that policy discussion was going to be at the July meeting, which didn't happen. And now I've heard that it was going to be at the August meeting, but it's not indicated yet at the August meeting either. It seems like things are piling up here. We get into a discussion and we mention, you or I or the public or whoever, that, well, what's the policy on this? Or maybe we need to have a policy. Well, it's, we need to have that framework discussion, I would think. And as it keeps dragging on, more decisions are made without policies in place. And one policy that was discussed this evening was the green pavement marking policy. And Mr. Cronin said that he wanted to see that policy before he will even consider green pavement markings, which I find kind of disturbing that he wouldn't even consider it unless there is a policy actually telling him to. But so we need some policy discussion. We need some direction. We need policy like about the radius of intersection corners. I mean, there's a number of policies that we could list here. And so I'm wondering, do we really need to talk about bike security in August? That's not something that's impending. I think maybe that could be bumped for a policy discussion. So I would request that maybe you consider that. Thank you very much.
Thank you. All right, we have a motion to adjourn and a second. I think we can raise our hands on that for adjournment. All in favor? Looks like a majority here. All right.
Thank you.
Thank you, everybody.